Good morning, Chair Bollendroff, members Garrett, Holmes, staff, and guests. The lobbies are open and the recording has begun.
Thank you, Gretchen. Good morning, everyone. I'll now convene the Board Caucus meeting for Tuesday, June 2nd, 2026. We have a robust agenda this morning, and I'll kick us off with our first agenda item. We're joined by Kristen Haley, our Public Health Liaison, who's going to give us an update about a recent Public Health and Prevention Roundtable meeting. So, Kristen, welcome. Good morning, and I'll turn it over to you.
Thanks. Good morning, Chair Bollendroff, members Garrett and Holmes. Kristen Haley, your Public Health Education Liaison, and I'll be giving an overview, like Jim said, of the latest Public Health and Prevention Roundtable that took place on May 28th. So we had about 66 people in attendance with representation of about 20 people from across LCB. The remaining 40 plus were made up of state agency partners and local public health and prevention coordinators. In the Microsoft Teams post-meeting summary, it now gives data for how many people had their cameras on during the meeting. And apparently, 43 of 66 attendees were on camera. And I think that's a really great metric for engagement in a space like that. I never thought to measure that, but now I'm totally going to. The roundtable covered two main topics: implementation of 1515 and an overview of the rescheduling of medical cannabis at the federal level. So speakers from licensing, education, and enforcement, and the research program provided overviews about the rollout of 1515, otherwise known as the FIFA World Cup Bill, or otherwise known as the Alcohol Expansion Bill. Their presentation covered a number of things. They gave a high-level overview of the bill and how it's been implemented, common misconceptions about what the law does and does not do, an overview of approved jurisdictions, including a walkthrough of the GIS map that folks can use as a resource. And then they talked about what enforcement will focus on. And finally, Dr. Sarah Oki walked through the Public Engagement Review, which is a tool the research program developed to support cities and communities in how they collect data and then can report that to the legislature. They also provided a ton of resources related to expanded services. During the Q&A, folks asked for clarity about whether these locations will be age restricted, whether LCB received additional funding for enforcement, and how many officers will be on location during those time periods. And folks from across LCB answered those questions in the chat and on screen. Attendees also shared a number of resources for other attendees to leverage, which was really cool to see folks at LCB and external partners sharing those resources. I packaged all of them up and then I shared them with the list of folks who I invited initially to attend. Then we switched gears, and Justin Nordhorn, our Director of Policy and External Affairs, provided a very, very high-level overview of what we understand right now about the federal rescheduling of medical cannabis from Schedule 1 to Schedule 3. As you all know, there is a lot we still don't know, so this was mainly our attempt to just level set with folks in the field who haven't been tracking the news on this topic at all. And then when we listened to questions from attendees and answered what we could, many of our answers were, we don't know yet. So interestingly, most of those questions were actually related to interstate commerce. There weren't a whole lot of questions getting into the technicalities like we've heard from folks from the cannabis industry. Our next roundtable will be on September 17th, and the final one for the year will be on December 9th. Topics have not yet been determined, and I've been encouraging partners to let us know if they have any suggestions. Both of the topics that we talked about on last week's roundtable came from our partners, which I think is a really fun way to make sure that they feel heard and that we're staying relevant to their interests. So that concludes my update. I'll open the floor to you, Chair Bollendroff, to add anything that I missed, and of course to members Garrett and Holmes to ask questions.
Thank you very much. What a great update, and appreciate the detail. So I was in attendance, and Kristen did a great job as usual leading the meeting and facilitating engagement and conversation along the way. I think it was also particularly around 1515 a great illustration of cross-agency collaboration across the LCB to accomplish something that's kind of complicated, and that's 1515. And so having licensing there, having E&E there, and having our research team present and do it in such a way that it demonstrates how they're working together to implement this complex bill in a comprehensive way was great. So thank you for that. And Kristen, the only other thing I was going to mention, and you already did, but I just want to highlight it, was the development of the agenda being largely at the request of the prevention public health community. And I think that was just another great way for us to demonstrate our willingness and desire to collaborate with the community. And would continue to encourage that. So with that, I will open it up to other board members for questions or comments. Anything? All right, seeing none, thank you very much. Look forward to the next one. And again, great job on your part facilitating both the agenda and the meeting. All right, so you are up again for our next agenda item, which is the Washington Healthy Youth Survey. And I see that you have others who are presenting with you this morning. And so I will let you introduce the rest of your team and take it from here.
All right, thanks for that. So good morning again, Chair Vollendorf, members Garrett and Holmes. Oh, let me share my screen. Doesn't help if only I can see it. Are you seeing the slide deck now?
Yes.
Great. So yeah, again, Kristen Haley, Public Health Education Liaison, here with a few colleagues from the Healthcare Authority to share recent Healthy Youth Survey data with you all. We should have plenty of time for Q&A and at the end, but if you have clarifying questions throughout, please feel free to chime in and we'll answer those along the way. With all my screen sharing, it's kind of hard to see hands being raised, so just feel free to come off mute and jump in. Like I said, I brought several of my colleagues from Healthcare Authority who also represent part of the Healthy Youth Survey Planning Committee to help today. Sarah Mariani and I will be giving the presentation, but Jamie and Rebecca will be available during the Q&A portion to help us answer any of your questions, as they're more data-minded than we are. As a reminder, Healthy Youth Survey is implemented in the fall in grades 6 through 12 across Washington every other year. So the data we're talking about today was collected in the fall of 2025. I think this is a nice complement to the presentation you heard from our colleague, Dr. Jason Kilmer, a couple weeks ago, where he walked through the Young Adult Health Survey. I intentionally wanted those two presentations to take place close together because I think it's really helpful context to think about youth prevention and harm reduction just across that broad range of ages. But keep in mind, the Healthy Youth Survey and the Young Adult Health Survey are two different surveys, served to different age groups, and they use totally different methods. So we can take both as, both sets of data into one context and then think about what the findings might mean, but we can't really draw like direct comparisons. Just a disclaimer. All right, so you can see on this slide, it's a massive partnership to pull off the Healthy Youth Survey. 4 state agencies, Healthcare Authority, Department of Health, the Office of the Superintendent of Public Instruction, and of course, Liquor Cannabis Board all co-manage the survey. Although we implement in the fall of odd number years, there's this cycle where we analyze the data, communicate the data to folks, which is where we are right now. And then we make revisions to the survey, submit for IRB approval, and then start recruiting schools. So we start the cycle back over again. So it's a year round across the 2-year cycle, sometimes daily effort. And it's a lot of work and it requires a ton of coordination, a lot of diplomacy, and a lot of just staying connected between all the groups listed. We also couldn't do this work without the contractor Looking Glass Analytics listed here, or any of the state partners you see on this list. So this survey measures youth responses across mental health, physical health, school, community, and family supports, and behavior and attitudes around things like substance use. Please keep in mind, in order to make this presentation relevant for you all today, we're just focused on this tiny narrow scope, the substance-related and policy-related items out of the many, many questions that we cover across all the different topics on the survey. So we just want to keep that in mind. We're going to cover this little thing, but there's a whole lot more out here that we could be talking about that's just not as relevant to LCB. We do the survey so that we can do a few things: understand and track trends over time, see a snapshot into the lives of our youth that can help us make more informed policy decisions and evaluate programs and systems. And many folks at the local and state levels rely on this data when submitting for funding or reporting on progress to policymakers. One quick note before we jump into the data. Unless we say otherwise, all of the data we'll be walking through is from 10th grade survey participants. And we do this for a few reasons. I'm not going to go over all of those reasons, but for your reference and to make it make more sense, I'll explain a couple. So first, we typically have the highest response rate for this age group, so we can be most confident about the results, and we can usually do a little bit deeper analysis with those results. And then when we think about the age and lived experiences of 10th graders compared to younger grades or older grades, they're like this sweet spot. So looking at this age gives us a really great idea about what exposures they've already had, but then it also helps us refine our prevention strategies as they age and they become that older cohort eventually. And this helps the broader prevention system with evaluation and planning. And of course, across the prevention system, we pay attention to all the different age groups that we question. We look at all the different geographic areas and specific demographic groups to better understand our youth. But this presentation will mainly cover 10th grade results and only at a statewide level. Okay, with that, I'm going to hand it over to Sarah Mariani to start walking us through the data. Are you with us, Sarah?
I am.
Okay,
Thank you, Kristen, for that lead in, and good morning, everyone. Thank you, Board Chair Volendroff and Board Members Holmes and Garrett for having us today. Again, as a formal introduction, I'm Sarah Mariani. I'm with the Healthcare Authority. I serve as a section manager responsible for substance use disorder prevention, mental health promotion, which includes overseeing the administration of both the Young Adult Health Survey, which you heard about in your previous month, as well as the Healthy Youth Survey. And as Kristen mentioned, today we're focusing on the results of the Healthy Youth Survey. So to dive into those results, overall, youth substance use rates have been steadily declining for the last 2 decades in Washington state. In our preliminary results this year, we're seeing that substance use rates remain low since a substantial drop that we saw first in 2021. As you'll see on this slide, among 10th grade students, past 30-day substance use rates span from about 5 to 7%, with less than 2% reporting cigarette use. Each of these 30-day rates are lower than our comparable national results, such as the Monitoring the Future study, which is a longitudinal study administered in schools using similar methods to the Healthy Youth Survey. So it is the most comparable study. So overall, this is really good news for us. As we look at the next slide, we'll see that this chart shows those more recent decreases in 30-day alcohol use over time, which also have held true for lifetime use and binge drinking as well. This is where I'd like to note there was a break in trend in 2020 due to the pandemic, where we shifted to an online format for the survey and began implementing the survey in odd years to catch back up. Therefore, it's important that we're really cautious, and you'll hear us talk about this as we go, about how we talk about trend, knowing what our trends from 2018 and prior versus our 2021 moving forward trends are. Additionally, until we have at least 4 data points, we are reluctant to confirm statistical trends so that we can make sure that we feel confident that a trend is developing. And so that's why you see the dashed lines from 2021 to 2025, although we will talk about what we are seeing currently. We just aren't confirming a broad trend. So as we dive into the next set of results again, we see that the decrease in youth substance use also holds true across other items such as 30-day use of painkillers, prescription drugs, and other illegal drug use. All told, those rates all remain very low after they had that steep decline beginning in 2021 and are under 1% amongst 10th graders. So importantly, and this is something that we really like to emphasize to help counter some of the social norms that suggest that substance use is a normal part of growing up. One of the things that's important to note is that when we look at 2025 results, most 10th graders say that they have never used these substances in their lifetime. So ultimately, the takeaway is by 10th grade, most youth have not used yet. And that's really good news for the health of the youth and brain development and all kinds of ways that we can support youth moving forward. Back to you, Kristen.
Yeah, thanks, Sarah. So I recognize that at LCB, we don't regulate these rare substances you see on the screen, but I also know we are asked about many of these all the time. So I thought it would be interesting for you all to see, like Sarah was alluding to, there is some use reported, but the rates are relatively quite low across the board. A couple notes of context for this data. In 2025, we moved from asking questions about rare substances in terms of past 30-day use to asking about lifetime use or have you ever to save space on the survey. And that means, unfortunately, we no longer have the ability to think about trends related to this data. We'll need a couple more cycles to talk about trends across time again. And that said, using the eyeball test, it looks like 2025 estimates of lifetime use are really not too different from the 2023 estimates of past 30-day use rates, but we can't mathematically or technically speaking draw those specific conclusions. But I just thought you would be interested to see about those data points. Okay, now we know that one of the most interesting HYS data points for folks at LCB are these ones around access. Youth only respond to this if they have indicated past 30-day use. So we can't read this slide like 9% of youth in Washington stole alcohol from a store. Instead, we have to say 9% of youth who reported consuming alcohol in the past 30 days indicated they stole alcohol from a store. It's just a really important caveat so we don't run away with this slide too far. But you can also select more than one option. So that's why these numbers don't add up to 100. And there were other options that were quite low, so we didn't include them in these bar charts. The big takeaway is that the primary forms of access continue to be social, not retail, for both alcohol and cannabis. Well, that's likely good news overall for the efforts that we conduct at LCB. This shows the broader prevention communities some of the areas for us to focus our efforts statewide. And a few things for us to consider, just from my perspective as your public health lady at LCB. This data is most valuable when we interpret it in context of both LCB compliance data and the anecdotal reporting we hear from communities. So those three pieces should be taken in all together. And then I think that gives us the most clear picture about how youth are accessing these substances. With that in mind, I think the data on this slide complements compliance check data for the most part. So for example, we know that cannabis compliance rates are consistently in the 90s percentages. And according to HYS, youth who report buying cannabis at a store is quite low, which makes sense with our compliance data. Also, the self-report stole from the store is really low, which also makes sense with things like store age gating. And the cannabis bought at a store might include things like youth who have medical authorization, so they legally purchased it from the store with their medical authorization, or youth who purchase THC products at physical retail locations that are not licensed within the regulated market. While there legally shouldn't be any of these stores, we know that still some pop up and exist. And this data might help reflect those stores as access points and give us an idea of the landscape of what might be going on across our state. It tells a part of that story at least. I think it's interesting that our alcohol compliance rates are usually lower than cannabis, but according to HYS self-reported data for bought at a store, only 3% of 10th grade participants reported access to alcohol this way. Also interesting and not depicted on the slide, 12th grade participants report almost 10% bought from a store and almost 4% stole from a store. So I just think that's really interesting. It's almost inverse to what we see in the 10th grade, which makes sense. As they get older, they get bolder. But it also is a really great example of why we should look at HYS data and compliance data together, and not just 10th grade, but all ages, to start to tell that story. And we get a more complex and accurate version of the story when we do that. I also think it's interesting to think about the alcohol access data for any grade, both for self-reported stealing and purchasing, in terms of the open rules project for alcohol product placement that we're working on at LCB. I think this is a really important data piece for that work. And not listed here, but for access via social media or internet, which I know is something a lot of us at LCB are really interested in, this was less than 2% for alcohol and 3% for cannabis. And this was the first year we asked this question for these substances. We previously only asked it related to tobacco and vapor products. Similarly, with tobacco and vapor products, among those who reported past 30-day use, we see about 6% bought from a store and about 4% reported stealing from a store. And again, about 3% reported purchasing online. So we ask youth about their perception related to enforcement of youth drinking and cannabis. This slide, I'm just looking at alcohol. You can see over time, youth increase their belief that a kid would get caught by the police if they drank alcohol. Taking all the data that we've talked about so far together, we think this complements the access data that is showing low retail access. We're thinking that perhaps the perceived risk of getting caught drinking is high enough that fewer youth are willing to risk purchase attempts. We don't know. We can't know for sure, but it's just an interesting thing to consider, and I think a good example of how we can use this data to sort of theorize what's going on. It's also important to note, though, that perceived enforcement or being caught by the police is increasing in 2025, with the caveat that our response options changed this cycle, which may have made the question make more sense, which is great in the long term, but it also might mean that on this cycle, more kids said yes, which was leading to these higher responses. All right, so this is the same question, but with cannabis. You can see the alcohol and cannabis slides are almost identical, so I'm not going to spend a lot of time on this, but I thought it would be interesting for you to see that it's really similar to alcohol. With that, I'm going to hand it back over to Sarah to walk through some mental health data.
Thanks, Kristen. Really important considerations. So we also wanted to highlight some of the preliminary mental health results, since they are related to substance use. We know from decades of prevention research that anxiety and depression are each risk factors for substance use, and early and persistent substance use can also lead to the development of anxiety, depression, and suicide indicators, including death by suicide later in life. Mental health indicators also share risk and protective factors with substance use, some of those that Kristen was just mentioning. Our prevention community practitioners, as well as the treatment partners that we work with, know this well and plan their services accordingly. And thankfully, we're seeing continued decrease in mental health concerns as we started to observe before the pandemic. Above and beyond that, feelings of anxiety and depression among 10th graders have decreased significantly since 2023, while suicide indicators have remained steady. As we look at these graphs, we can see that the decreases we are seeing in depressive and anxious feelings after the pandemic. It's important to note this figure indicates that youth do not feel that they have at least one adult to turn to when they're feeling sad or hopeless. However, fortunately, there is a decrease in youth reporting no adult to turn to, which coincides with improvements on mental health concerns. And we know this is important because we know having an adult to turn to is an important protective factor associated with less anxiety, depressive feelings, and suicide indicators. As we stated previously, you see the break in trend here between 2018 and 2021. So we continue to demonstrate the data in the dotted lines from 21 to 25. And we are looking forward to our 2027 data collection to be able to confirm and discuss trends. This next slide talks a little bit more about where else we're seeing social support. So what we're finding is that in addition to supportive adults, those results are being complemented by students feeling more supported by people in general in school, having successful school outcomes, And looking at how we compare those with other risk and protective factors, we see that students overall are feeling supported from multiple people in several different spaces. The programs, policies, and strategies in place to provide these supports appear to be paying off in our data, which is really great news. And with that, we'll wrap up with a few takeaways here, Kristen, and then we can answer questions if there's time.
Thanks, Sarah. So to just summarize what we talked about today, it's important to look at data to see all of the trends, both the ones we want to see, and of course, keep our eye on the ones that we see as alarming. Many key health indicators are trending in a positive direction, which is great. Substance use has most recently remained steady since 2021 at about half of what it was pre-pandemic. But we know this is in part due to the work many of our agencies and partners have done to prevent and reduce youth use. So I caution folks seeing this data and thinking like, yes, we did it, the work is done. There continues to be work, of course. Mental health trends continue in the right direction, although there's still a ton of work to be done to get these rates where we want to see them. Even for some subgroups of youth who often face more barriers to mental health, we see positive direction, and that's good. I think this is a promising trend for continued progress with substance use rates and something that we should continue to be tracking at LCB. I know it's not directly related to our work at LCB, but because of that tangential relationship, I think it's important for us to be aware. Thankfully, youth report more social support, like Sarah was just saying, both at school and at home. And although we didn't dive into this data today, we want to just flag here that disparities remain, and some indicators are still way too high among certain populations, like youth with disabilities, youth within the LGBTQ population, and in some racial and ethnic groups. So the big takeaway for us as the Healthy Youth Planning Survey as the Healthy Youth Survey Planning Committee is that we can't pull back our momentum. And as we see it, we need to continue working together to support youth, to continue making positive changes. And I think that includes continuing to strengthen that relationship between folks throughout LCB and the prevention folks doing work across Washington. So that concludes the data presentation. We can open the floor for questions. And of course, we want to say thanks to our HCA friends for joining this presentation today. And thank you all for inviting us to the caucus.
Thank you so much. Really appreciate it. I'll open with a couple of comments. First, I want to thank the Healthcare Authority team for participating. And Sarah, this may embarrass you, but I'm going to say Sarah and I have worked together for, I won't put a year on it because that might embarrass both of us, but for a very long time. And it's great to see you in such an important leadership role at the Healthcare Authority, and great to see the work that's occurring at the Healthcare Authority pay off. I also want to acknowledge the Department of Health, SPI, and just think it's such a great example of cross-departmental collaboration in the state. And as Kristen and Sarah pointed out, this data in isolation tells one story, but when you couple it with other data across state agencies, it tells an entirely different story, or a deeper or richer story. And so that work with the E&E and this data together helps us make good public policy decisions. And so that leads me to my first question, Kristen. And I know that there are E&E partners who, one, sit in on this meeting, and two, who may watch this later. But do you ever sit down with them and go over a more in-depth presentation and talk specifically about their data, our data, and what the implications are outside of this process?
Yeah, that happens in 3 places. So sometimes I get requests from folks, usually in E&E, who have been asked to come speak at a community where they are local. And so we'll sit down and build a slide deck together, or I'll feed them slides or feed them HYS data to inform their presentation. And then 2, sometimes when we release the HYS data, I'll get one-offs from various officers who want to just understand the data in their region or specific to their topic of cannabis, alcohol, tobacco, vape. So we'll have a meeting with folks, and anybody who's listening now across the agency, I'm happy to have those meetings whenever. And the third is a new one. So as you might be aware, our unit under Justin Nordhorn is doing policy unit spotlights every quarter. And we kicked them off last quarter and asked folks across the agency which topics. We gave them a poll of topics to choose from. And like the vast majority of folks requested HYS as the
Oh, that's
topic for the
great.
next quarter. So after this presentation, I'm prepping one for next week that will be much deeper and broader. We're going to also talk about how to use the HYS website and all the different resources to better understand data. So I think that'll be a fun tradition, maybe every cycle when we release the survey, to do a deep dive internally.
Great. Well, you and Sarah are a dynamic duo, so perhaps you can convince Sarah to participate with you in those presentations. I was particularly pleased to see some mental health data in here this morning. I think that that is another example of great information being presented regarding the linkage between substance use and mental health, and how they're not, separate things, and that there's oftentimes a linkage and important policy considerations for us to take into consideration. So thank you for that. Sarah, I wanted to go back to the area where I think it was you presenting on the slide about perception of youth and of use by youth. And I think that that's an important message to continue to get out there, that the vast majority of 10th graders have never used in a lifetime. Is that the perception of young people who believe that? I don't know if I'm asking this question well. I'm just wondering, do youth, 10th graders, for example, believe that more people use than actually do, and so therefore it's important that they get this message? Or is it adults who believe that the majority of people use and they in fact don't? And just, can you clarify that a little bit?
Yeah, absolutely. So I don't have the data offhand for exactly what you're asking for. I know in the young adult health survey, we do that sort of comparison of what do you think versus what do you do. What I will say is generally speaking, what we hear is that youth, similar to the young adults, youth also think and have the perception that more other youth are using. Their peers are using. That's what we hear. We definitely can confirm that in the data as we have it available. We can follow up with the board. Similarly, we also hear from parents. So at the Healthcare Authority, we have a program called the Community Prevention and Wellness Initiative. I know you're familiar with it, Jim. And this is an initiative, for those of you that aren't familiar, where we're working in communities and schools, and we're working directly with those communities and schools to say, what are you hearing and seeing, and how would you like to address that? And one of the things that frequently comes up in those norms conversations is a disconnect between the norms that parents and adults in the community have compared to what the use rates are and then what the youth feel. And we have that on a few different indicators. We also have a survey called the Community Survey, where we survey adults in these communities and can look at those results. So by and large, to answer your question, we see that there's still a disconnect between the anecdotal feeling and social norms that people have around how much use is happening, which is partially why we like to point out that it actually can be protective for us to get clearer and support those youth that are choosing not to use, and reduce that kind of what we often call peer pressure, but it's almost societal pressure, that it doesn't have to, there isn't necessarily still that pervasive piece that's showing up in the data that a rite of passage is by 10th grade, you must have used substances. And quite frankly, most youth haven't. And so the more we can reinforce that, the more that youth can feel agency in their choice, and understand that that's empowering versus disempowering. Similarly with the adults, encouraging that message so that adults don't fall into that same sort of thinking of like, well, it's okay, don't all kids use, and that sort of thing. So Kristen, it looks like you'd like to add.
I would just point out, because I think this is really relevant to a lot of the rules that come across all of your desks, that this is a systems-wide approach, that like perception is a compounding thing. So it's not just perception of whether your peers are using, but also the perception of harm, the perception of whether or not you get caught. I talked about that police data, the perception of how frequently people in society are using. So what we see in the media, the marketing, the advertising on the road, the density of outlets on in a neighborhood, all of those things kind of compound and add. So it's not just like one piece of the perception, it's like the general societal perception. And I think that's one of the things, sometimes prevention folks get on a soapbox about marketing and advertising and want to be really specific about what that looks like, or people talk about density. And those things are because it's all feeding into that compounding perception of harm for youth.
Great. All right. Well, thank you very much. Any questions or comments from other board members this morning?
No, I just wanted to say this was great information and positive to see that things is going the direction that they're going.
Yes, I agree. Thank you. Board Member Holmes, anything?
Yes, just want to say I'm also very encouraged and agree that the work continues. We're not done yet. And so, but it is gratifying to see that the efforts pay off. So thank you.
Yes.
Yeah.
All right. Well, thank you both very much. I concur with what each of the other board members said. I will also point out that this does not happen in isolation, and our retailers and our licensees are as an important part of this as we are, and their hard work and work to assure that sales to minors and things that impact young people are adhered to, and everybody on the not everybody, I'll say the vast majority of our retailers are doing a great job at helping us achieve some of these outcomes as well. So I appreciate all of you as well. All right, thanks very much, and see you soon. And we will move on to our next agenda item.
Appreciate it. Thanks.
Thank you. All right, well, we are right on schedule, and so we are going to transition to our policy and rules team, who have multiple updates for us in board meeting prep for tomorrow. So we have Kevin Walter, who's here with us today, and Kevin's going to give us a general update, and then it looks like the majority or all of the rest of the items are with Jeff. So Kevin, we'll start with you, and when you're done, you can just turn it over to Jeff.
All right. Good morning, Chair Vollendroff and board members Garrett and Holmes. As we make our way into June with summer right around the corner, the rules team currently has 14 rules projects open at various stages of development. Starting with cannabis rulemaking, most recently we filed a CR 101 on May 14th to initiate rulemaking to implement engrossed House Bill 1941, allowing agricultural cannabis cooperatives. Under the bill, up to 3 cannabis producers can form an association to collectively process, handle, and market their products, just like any other agricultural association permitted under state law. The informal comment period runs through July 3rd, and we'll be announcing stakeholder engagement efforts to follow in the coming weeks. We're also continuing to evaluate and reevaluate comments and stakeholder suggestions as we develop the next Cannabis Retail Management Agreements draft, implementing engrossed substitute Senate Bill 5403. We have sought input from the Office of Minority and Women's Business Enterprises for an outside neutral perspective, particularly with regard to the matter of discounts and the potential advantages or disadvantages that differing approaches might have on social equity licensees and smaller retailers. There's still a lot in flux, but we do expect to have more concrete information regarding next steps by next month's board meeting. The comment period on cannabis license fees, implementing engrossed House Bill 2681, ends on June 23rd, and we expect to file the CR 103 to adopt final rules following next month's board meeting on July 1st, with rules becoming effective immediately. Then we're in somewhat of a holding pattern on R&D testing and samples rulemaking, with other more immediate priorities taking precedence over the past several weeks. The timing is perhaps fortuitous, however, given that the Department of Health has indicated that they'll be filing a CR 102 sometime within the next few weeks to propose new rules that will impact cannabis labs. And the Department of Agriculture has also recently filed a CR 101 to initiate rulemaking focusing on labs as well. So it makes sense to monitor those developments and coordinate as necessary with those agencies to ensure alignment with our rules as we move forward. And then lastly, as indicated on the agenda, Jeff is going to be requesting board approval tomorrow to file the CR 103 to adopt final rules on cannabis advertising, implementing Senate Bill 5206. I also wanted to briefly mention federal rescheduling of medical cannabis and potential rescheduling of cannabis more broadly has stirred a fair amount of interest among our cannabis stakeholders. So I just wanted to acknowledge that we're monitoring the situation. There doesn't appear to be any immediate implications regarding LCB rules, but we understand that things are evolving rapidly and this could change. So we're doing our best to be in position to respond accordingly should the need arise. Moving on to alcohol rulemaking. We recently announced stakeholder feedback sessions to be held next week on Monday, June 8th from 1 to 3 p.m. and Thursday, June 11th from 10 a.m. to noon for our rulemaking to implement Second Substitute House Bill 1701, which allows liquor licensees to lease space to one another. The draft rules that we'll be focusing on and other pertinent materials have been posted to the rules webpage. And the economist conducting the cost-benefit analysis and small business economic impact statement on the retail alcohol product placement rulemaking completed the survey of potentially impacted licensees at the end of May and is on track to complete the analysis by the end of this month. A preliminary evaluation of the responses looks favorable for moving forward with the CR 102, likely in September, and final rules being adopted by the end of the year. Although we don't anticipate significant compliance costs associated with the rules, the new display requirements would be enough of a departure from the current status quo that the effective date of the rules will likely be delayed by a few months following adoption to give retailers ample time to make the necessary adjustments. The comment period on the expedited rulemaking to implement engrossed House Bill 1526, allowing snack bars to serve wine by the glass, and engrossed substitute House Bill 2476, increasing the number of seats that a spirits, beer, or wine theater can have to qualify for a license, ends on June 23rd, and we expect to file the CR 103 to adopt final rules following next month's board meeting on July 1st. And finally, just as a reminder, the contract kitchens rules implementing engrossed House Bill 1602 that were approved and adopted last month will take effect this Saturday, June 6th. Then with regard to petitions, following my update, Jeff is going to be previewing our recommendation on 5 petitions that we recently received from Amy Deluge of the Green Seed, a cannabis retailer in Moses Lake. And we also received another petition from representatives of Eagle Tree Farms, an outdoor cannabis producer, requesting rule amendments that would expand the allowable cannabis canopy space for Tier 2 sun growers from 10,000 square feet to 30,000 square feet in light of their limited opportunities for harvest as compared to indoor growers. We'll be presenting our recommendation on behalf of the Director's Office for that petition at next month's board meeting. So that should cover it for rules. I'm happy to answer any questions that you might have.
Thank you, Kevin. Any questions for Kevin? All right, seeing none, Kevin, you can turn it over to Jeff if you're ready.
All right, Jeff, go ahead. Thanks.
Thank you.
Thank you, Kevin. Good morning, Chair Vollendroff and board members Garrett and Holmes. At the board meeting tomorrow, the Director's Office will request approval to file the permanent rulemaking CR 103 package and updated rules to implement engrossed Senate Bill 5206, the recent legislation regarding expanded advertising options for cannabis retail store licensees. ESB 5206 makes a number of changes to the rules in WAC sections 314, 55, 155, including allowing up to 4 signs on the exterior of a retail cannabis store up to 1,600 inches in size, exempting smaller signs if they're less than 512 inches, if they include only general store information, and also allowing retail licensees to have up to 2 trade name signs that must comply with the local government regulations in their area. 5206 also bars cannabis advertising from portraying alcohol, nicotine, or tobacco use, or any associations with motor vehicles. And 5206 allows for adopt-a-highway signs for licensees that participate in this litter cleanup program. 5206 also prevents cannabis advertising from appearing in other businesses that are licensed by the LCB under RCW chapters 7345 regarding vapor products, chapter 8224 regarding cigarettes, and chapter 8226 regarding tobacco products. The public rulemaking hearing for this rule was held on April 3rd, or I believe it's 23rd, and there was no testimony at the hearing. At the very end of the formal rulemaking comment period, stakeholders submitted a few comments that we took extra time to consider, and adapt into the proposed rules as we prepare them for the final draft, including clarifying that trade name signs may include business logos or artwork if it does not depict cannabis or cannabis products. These comments led to the director's office postponing presentation of the CR 103 package from the May board meeting to this month's meeting so that we could consider the stakeholder suggestions received at the very end of the comment period. If approved tomorrow, these permanent rules will be filed right away with the Office of the Code Revisor, and the permanent rule changes will take effect on Saturday, July 4th. And I'm happy to answer any questions about that rulemaking package.
Thank you, Jeff. Any questions for Jeff? Seeing no questions, Jeff, we're ready to move on. That's thank you for the presentation.
Great, thank you. Thank you. Okay, good morning again, Chair Volendroff and board members Garrett and Holmes. At the board meeting tomorrow, the director's office will present the director's office response and recommendations regarding 5 petitions for rulemaking received from Amy Deluge, the owner of the Green Seed, a licensed cannabis retailer in Moses Lake, Washington. These 5 petitions were received by the LCB between April 29th and May 20th, 2026. The first petition response we will present will be for the petition for rulemaking received on April 29th. This petition concerns requested rulemaking to require independent third-party review of agency interactions with licensees in specified situations. The second petition we will present concerns WAC 314-55-083, the subject being rule amendments to require the issuing of a formal declaratory statement by the LCB regarding the limitations of the Cannabis Central Reporting System, or CCRS as it's known, and requiring written disclosure regarding CCRS limitations to licensees. The third petition requests emergency rulemaking to align CCRS with full federal cannabis compliance and traceabilities expectations, unquote. The fourth petition concerns existing rules under WAC 314-55-083 governing cannabis traceability, licensing activity validation, and supply chain reporting, and requests rulemaking for emergency and permanent rules establishing enforceable operational verification standards. And then the last petition, the fifth one, the fifth petition for rulemaking requests more emergency rulemaking to WAC section 314-55-083 regarding cannabis diversion, seed to sale accountability, protecting public health and safety, preventing criminal exploitation of the regulated market, and preserving lawful market integrity. I will provide more details and analysis of these 5 separate petition requests from one stakeholder at tomorrow's board meeting, along with recommendations from the director's office. Thank you for your consideration of these rulemaking petitions, and I'm happy to answer any questions.
Thank you, Jeff. Any questions for Jeff this morning? All right, seeing none, thank you. Appreciate it, and we will hear more detail tomorrow. So thanks very much, Jeff.
Thank you.
All right, that leads us to our last agenda item, which is board member and executive assistant reports. So anything from my fellow board members this morning?
Just wanted to mention, Mr. Chair, that I had a great meeting on Friday with Paul Beveridge of the Will Ridge Winery here in Washington, a mini tour, if you will, but more importantly, hearing a lot of the concerns and challenges facing our state's small wineries. And it was very, very helpful. I really appreciated his time. Thank you.
Great, thank you for sharing that. All right, anything from Gretchen or Deb this morning?
Nothing today, Chair. Thank you.
All right. Well, thanks, everyone. That concludes our board caucus meeting for Tuesday, June 2nd. I will adjourn the meeting. Thanks, everyone. Have a great day. Bye.